As Northumbria Healthcare NHS Foundation Trust continues planning for Britain's first specialist emergency care hospital, this was the occasion when they called in other expert help. Around 40 young people from 8 schools and youth groups were invited in for what was called a Takeover Day to help emergency care consultants, architects and senior healthcare managers shape the new service. Takeover Day was part of a series of events prompted by the Children's Commissioner to allow young people a chance to get involved in major decision making.
Do want you to enjoy the day?
My name is Pisha Rana and I'm Project Director for the new Specialist Emergency Care Hospital. The purpose today was very much to engage with our younger clientele with regards to understanding their views and perceptions of the new Specialist Emergency Care Hospital. Obviously we've started building now and we could share that with the people that were here today. Of particular interest to us was how they understand the language we commonly use when describing healthcare in general, but for us as an organisation, the new model, and really taking on their views about how we could communicate that moving forward.
This followed a turf cutting ceremony to begin the multi-million-pound project. The new hospital will include a consultant-led accident and emergency unit, admission and inpatient wards, high-tech diagnostics, maternity services and children's care short stay and paediatric facilities. For these young people, there was an opportunity to influence internal decor, communications with their local communities and policy guidelines.
My name's Tracy Scott. I'm a clinical research coordinator and the patient carer parental involvement lead for child health, and it's my job to ensure that children and young people have got a voice across the trust, and it's really important we engage them to ensure we get the services right for children and young people.
Most of the stuff I heard was new because I just found out about it when we got offered this opportunity at school. Like, that was the first thing I heard about a new hospital.
Well, I knew it was getting built because I grew up cram London quite a lot. Today I found out quite a few things, that, like what's going to be in it, what's going to be around it, and like we've got to decide some things that have to be in it. Like basically it's our decision what can go in it, like what colours the wards are and like how do we want the corridors in the wards.
Me, myself, wants to be a nurse, so anything to do with the NHS I'm very interested in. So I think if you've generally got an interest, you'll want to come to open days like this and get involved.
Well, first we were talking about the name and we thought it shouldn't be too boring so everyone understands and it's comfortable, it makes you feel safe and secure, and then we had to talk about the way it looks, so we thought it shouldn't be too bland. We should have Wi-Fi and stuff because it's more young people in the paediatric department.
Stuff that we don't want to see is absolutely bright colours that give you headaches. We're going to be proud of it because I put some ideas towards it, so some of my ideas might appear up in the hospital.
We might not necessarily work there, but we might have to go there to have treatment, and to be in there and think, yeah, we helped make this, just gives you that little bit more of a buzz.
I think we try and listen to everybody who's going to use our service. Just because you're 15 doesn't mean we shouldn't listen to you. Designing a service that's friendly for children at a time when they're away from their families, when they haven't got their normal support, is important. We think we understand what they need, but they tell us something very different.
I think the value of today is to get back to the foundations. What do our service users expect from services that are delivered for children and young people? It's very difficult to second guess what children or young people are wanting from our services, and I think today we'll actually be able to get that information which we need.
We had comments about some of the decor within the new hospital, particularly with regards to the paediatric department, but just in general of ideas that we hadn't considered, and also communication mechanisms that we were familiar with, but we didn't realise quite the size of the audience that we could engage with by using other medias.
Learning from them, we can change the way the hospital environment works, we can change the way the service is provided. They know what they want, and it's our job to help to provide that. This will change the way the hospital looks based on what they tell us they want it to look like.
So we have a group that our governors are particularly interested in the new hospital, that we check ourselves against with regards to public perception, some of the language, the concepts that we're trying to get out there, and we want to do the same with the younger group here. They're They can then talk to their families, parents, grandparents, cousins. So the message is getting out from a whole different number of angles.
The day ended with teams voting on 144 suggestions from schools for a name for the paediatric ward. They selected a short list of 5 possible names, which will go for a final decision to a panel, including young people.